Hey everyone, welcome back to Injecting Knowledge. I'm Nurse Kaylee, and today we're going to be discussing valve disorders. The two main heart valve disorders that we will be discussing today is mitral valve stenosis and aortic valve stenosis. These are both critical to know as a nurse or nursing student, so grab your notes and let's get started. In this picture here, on the left, you will see a healthy valve, and on the right, you will see a non-healthy valve. On the right, the non-healthy valve can either not open all the way or not close all the way, causing a heart defect, which affects the blood flow through the heart. Let's talk about stenosis and regurgitation. In order to understand valve disorders, we need to be able to understand and know the definition of both of these. Stenosis is when the valve cannot open all the way, and regurgitation is when the valve cannot close all the way, causing a flow back in the blood. Let's talk about mitral valve stenosis first. Mitral valve stenosis is narrowing of the mitral valve opening, impeding blood flow from the left atrium to the left ventricle. People who are at risk are people with rheumatic fever, congenital defects, or previous mitral valve issues. Also, age can cause someone to be more at risk. Signs and symptoms of mitral valve include dyspnea, fatigue, palpitations, orthopnea, and cough. Treatment for mitral valve, we want to give these patients diuretics to decrease preload, beta blockers to decrease heart rate, and anticoagulants to prevent blood clots. And we also may want to perform surgery such as a valve replacement. Complications of mitral valve stenosis include heart failure, atrial fibrillation, and pulmonary hypertension. To prevent these complications, we want to perform regular echocardiograms, manage the hypertension, and administer anticoagulants to prevent embolism. We also want to improve cardiac output with medications, control heart rate and rhythm, and monitor for these complications. Next, we're going to be talking about aortic valve stenosis. This is narrowing of the aortic valve leading to reduced blood flow from the left ventricle to the aorta. People who are at risk are the elderly, congenital heart defects, and rheumatic fever. Signs and symptoms include angina, syncope, heart failure, and dyspnea. Treatment for this is valve replacement and medications for heart failure. Complications include arrhythmias, specifically ventricular arrhythmias, heart failure, and sudden cardiac death. To prevent these complications, we want to monitor for signs of heart failure and prepare for valve replacement. The priority action for the nurse is to administer diuretics to decrease preload, monitor vital signs, and prepare for surgery. Remember, one of the most important things as a nurse that we can do is to conserve as much energy as we can until this problem is fixed. I hope this video helped you understand mitral valve stenosis and aortic valve stenosis. If you like this video, don't forget to hit that like button, subscribe, and hit the notification bell so you don't miss any future videos. Thank you for watching. Happy studying, and I'll see you in the next video. Take care, future nurses.